Our story begins
as the Civil War ends in 1868.
American soldiers,
doctors,
nurses returned to their communities
and realized that our state needed something that it didn't have.
One centralized hospital to care for all 700,000 residents in Maine.
So Governor Joshua Chamberlain signed an act to establish Maine General Hospital.
And fundraising began.
By 1874, what is now known as Maine Medical Center welcomed its first patients.
In 1885, the first surgical teaching amphitheater opens.
And the hospital begins educating pre-med students.
A 2-year nurse training program is established.
And by 1900, Maine General is the center of medical education in Maine.
Through the early 1900s, technological advances like the X-ray are introduced.
And surgeries increased to 1,000 annually.
Despite the Great Depression, in 1931, Maine General added 4 new floors.
Recovery rooms, a modern marvel, adjustable beds, and an iron lung for polio patients.
Make Maine General one of the most modern hospitals in the country.
In 1951, Maine General merges with the Maine Eye and Ear Infirmary and the Children's Hospital to become Maine Medical Center.
The next 20 years bring many medical breakthroughs, from the first artificial kidney in 1960
to the first transplant in 1971.
Advances in cardiology lead to the first open heart surgery in 1959.
And the first miniature pacemaker in 1963.
The cardiac intensive care unit is created by 1967.
And the first coronary bypass surgery happens in 1972.
The Richards Building opens in 1969.
11 stories and more than 200,000 square feet.
It remains the hospital's largest clinical space.
The completion of the L.L. Bean Building in 1985 provides space for a new neonatal intensive care unit.
In 1991, Maine Medical Center Research Institute is created to foster research and advance medical discovery.
The opening of the Gibson Pavilion for cancer patients
and the inpatient unit of the Barbara Bush Children's Hospital in 1998
is hailed as a quantum leap forward for the hospital's ability to provide state-of-the-art healing.
The addition of a heliport allows for the achievement of a Level 1 Trauma Center in 2007.
MMC's long history as a teaching hospital continues with
Tufts University School of Medicine and Maine Medical Center establishing the Maine Track program in 2008.
To date, more than 250 have graduated from the program.
MMC also affiliates with local colleges and universities,
placing more than 1,200 undergraduates annually in nursing.
In 2008, the Family Birth Center gets a new home in the East Tower, nearly doubling the neonatal intensive care unit.
By 2009, the emergency department expands into the East Tower, doubling their space.
In 2010, the Hannaford Center for Safety, Innovation, and Simulation is opened.
The innovation cohort, which turns our discomforts into inventions, is established.
In 2013, Maine Medical Center is named one of America's best hospitals by U.S. News & World Report.
A distinction they would earn every year forward.
In 2015, MMC opens a new trauma center, Surgery 2.
The expansion includes state-of-the-art operating rooms
and patient-centered spaces for surgery prep and recovery.
The Clume Family Tower addition in 2019 is part of Maine Medical Center's expansion and modernization project.
that add 128 private rooms.
And 19 procedure rooms for surgeries and other complex treatments.
The Linda and Diana Bean Sisters Heliport also opens, allowing for 2 helicopters to land atop the Cologne Family Tower simultaneously.
For more than 150 years, Maine Medical Center has been a beacon of hope for our community.
As we look to the future,
moments of uncertainty will surely come.
But with the strength of our community at our side,
Maine Medical Center will be there
for the next 150.